Good afternoon, everyone, and thank you for joining us for today's webinar. We will be getting started momentarily. Good afternoon, everyone, and thank you for joining us for today's webinar. We will be starting here momentarily. We're just giving people a little bit more time to get admitted and get situated, but we will be starting here shortly. Thank you. Hi, and good afternoon, everyone. Thank you again for taking the time out of your day to join the Balm In Gilead and our Southeast Diabetes Faith Initiative as we have a conversation about diabetes prevention and you. We are excited that you have taken some time out of your afternoon to be with us. We are also excited to share with you some amazing information about the Southeast Diabetes Faith Initiative, as well as some key call to actions for what we can all do to not only prevent diabetes, but also just be healthier and have better quality of life, which after 2020 is something I know we can all agree that is much needed. So before we get started, just a few housekeeping things. So there will be opportunities throughout the webinar today to ask any questions, answers using our Q&A function. So if you have those, I've got an amazing coworker in the background, Miss Deja, who will be monitoring our Q&A for us throughout the session. So please make sure that you put any of those there. We'll also be sharing some forms and additional helpful information with you throughout today's sessions as well, so that we can continue to connect with you and continue to provide you information about this very important initiative of the Balm In Gilead. And then so at this point, before we can even get into the heart of today's discussion, we would be remiss if we did not invite the CEO and founder of the Balm In Gilead, our visionary leader, Dr. Pranessa Cecile, to give us greetings and kick us off this afternoon.
Well, thank you so much, Pam. And to all of you, thank you for joining us. It is always just our pleasure to just come into your home, your office, wherever you are, and remind you that indeed there is always a balm in Gilead. Thank you so much for joining us. I want to thank our Southeast Diabetes Faith Initiative team, all of them throughout the Southeast, Virginia, North Carolina, South Carolina, Georgia, Alabama, and Mississippi, for all of you who do just tremendous work. I am blessed here at the Balm In Gilead with the greatest team ever in the whole wide world, And I want to thank my deputy director, my right and left hand, who is running the show today. She is the absolute greatest. To Maria Rojas, our marketing communications director, and her team, Deja Jackson, and everybody at the Balm In Gilead. We make this thing work. Tanya Henderson, the director of our Southeast Diabetes Faith Initiative. You know, I am just blessed and highly favored to have just such a great team that makes it happen here at the Balm In Gilead every day. And we make it happen because we are committed. We are committed to changing the trajectory of health disparities in the African-American community. This is why we do this work. We believe in the work that we are doing, that we cannot go day to day, another week, another month, another year, another generation with the same health outcomes. And this is why we are so excited about the work we do at the Balm In Gilead every single day. I'm excited about this webinar. Our guest, Kimberly love lady, Lord have mercy, love lady from the Black Women's Health Imperative is with us today. And our sister, Nikki Gilbert Daniels, our dear sister, you know, she just sang. We just love it when she sings, the former lead singer of Brownstone. So thank you so very much. Pam, I'm going to give it back to you and I'm going to get out the way, sit back and listen to this very informative webinar. Don't y'all forget, don't take notes, get your stuff out, write it down, because we're going to get some really great information on reducing your risk for type 2 diabetes with the Southeast Diabetes Faith Initiative. And you know, don't forget, there's always a balm in Gilead. Back to you, Pam.
Thank you so much. Again, I also want to just to second to what Dr. Seal was saying. None of this would be possible without having an amazing team. And so they are also here with joining us today, some behind the scenes, some in the chat, some are on Facebook with us. But yes, first and foremost, Dr. Tanya Henderson, who continues to carry SDFI and our team along really under her amazing leadership, with me popping in from time to time, hopefully not being too disruptive. But really, again, just want to thank her for her leadership. And then to our amazing state managers, Mr. Travis Battle, who is our SDFI state manager for both North Carolina and Georgia. So he is obviously a man of many talents and is multitasking, covering 2 states for our Southeast Diabetes Faith Initiative. And then we also have the just beautiful and lovely spirit that is Miss Deborah Dunbar. And Miss Deborah is our state manager for South Carolina. And then we also have Tanya, again, she's doing a double duty because she's also serving as the state manager for the state of Virginia. And then for Alabama, we had Miss Regina Knox, who is actually still with us in the capacity of doing some special projects with us. But we were happy to bring on Miss Kristen Campbell, who is serving as our state manager for Alabama. And then we have also a cadre of amazing program coordinators, Miss Sharon Napper here in Virginia. We've got Miss Denise Raymond in South Carolina. We got Miss Charmaine Grant in Alabama. We got Miss Pat Yates, who I love to death. She's holding it down in Georgia for us. And we got Miss Monica Gilkey, who is holding down the state of Mississippi, which is our new state, new to the SDFI family. So again, before we begin, I want to give thanks to all of this amazing SDFI team. And then a big round of applause to Miss Maria Rojas and Deja Jackson, who all the beauty that you are seeing today was at their hands. They've also created an amazing contact form that they'll make available in today's chat, so that as throughout the presentation, if you want to get some contact information for our state managers, for just the program in general, please make sure that you can follow and complete that form, and we will have our state managers and our SDFI team get back to you with a quick response. And then again, we'll have some more and be sharing more information throughout. So I want to go ahead and before I bring on and have our guest, Kimberly Loveland, again from the Black Women's Health Imperative, and Nikki Gilbert Daniel, who is a strong advocate and proponent for women's health and health equity. So before I bring them on, I really kind of want to set the stage for why we're having this conversation. Today is National Diabetes Alert Day. But even more than that, SDFI, we are in our 3rd year. And so we wanted to really take some time to talk about why this work is so important to us, why we've invested so much of our time and energy. So the Balm In Gilead, we are actually heading into our 33rd, but we've had 32 years of being this connector between faith and public health. So the Balm In Gilead, our mission, our objectives are really about ways, strategies, approaches that are culturally appropriate, culturally tailored, culturally centered, and hinge upon faith and public health. We all, bared witness to 2020 and COVID-19, the social unrest. and then this new kind of resurgence, new focus on health disparities, diabetes being one of those. We also saw where as COVID-19 continued, diabetes began to be one of those underlying conditions, particularly for Black and Brown communities, that was resulting in much, much, much higher rates of death. And so this work is very, very important to us. And so across this amazing 32-year history, from the Harlem Week of Prayer for the Healing of AIDS to the African American Denominational Health Institute that, again, Dr. Seal was instrumental in bringing these two, or these actually not two, but these historical denominations together with the impetus of being able to address health disparities in the African American communities through congregations and local churches. And all the way up into our Healthy Churches 2020 National Conference, which is now reached into its new decade of Healthy Churches 2030, where we are in the midst of developing a 10-year roadmap that's going to look at strategies and approaches that, again, will take us 10 years into what we hope will be some meaningful impacts into addressing health disparities. And our Southeast Diabetes Faith Initiative is going to be a huge, huge part of that, because this program is about prevention. Because that's so important. We already know that Black and Brown people suffer more from type 2 diabetes. And so the Southeast Diabetes Faith Initiative is about doing what we can to prevent that. And so the SDFI, it's a program of the Balm In Gilead. It is right now a 6-state faith-based project that, again, was designed to expand the access and the utilization. I'm going to say that again, it's about the access as well as the utilization to the CDC's National Diabetes Prevention Program, or NDPP. And so we do this in partnership with our local faith partners, with different healthcare providers, clinicians, universities, and other key stakeholders, so that we can support and encourage not just the individuals who participate in the programs, but the surrounding community as well, to be healthier, both in mind and body, as well as in spirit. And that is the driving principle behind SDFI, is looking at diabetes prevention work through again, a more culturally tailored lens that looks to harness this power and influence of the faith community. So why is SDFI, why is the National Diabetes Program so important? There are 86 million adults who have prediabetes. Of that 86 million, 9 out of the 10 of people with prediabetes, they don't even know that they have it. That's a worse statistic than I think the Balm also continues to do work around HIV, where we know 1 in 4 individuals are unaware of their HIV status. And so this is a staggering number, first of all, of just individuals living with prediabetes, but then to have 90% of them not even aware that they have it is a problem. Especially when we know that without adjusting and incorporating more healthy eating, and really looking at that lens of what healthy eating is for our communities, but then also incorporating that moderate physical activity, we know that without those two things occurring, that a person with prediabetes is likely to develop type 2 within 5 years. Wrapped within that is also the other issues of other comorbidities. So high blood pressure, high cholesterol, all of those things are also at play with increasing your risk for developing type 2 diabetes. If you've already been diagnosed with prediabetes, and the difference between the two, because I also want to make sure that we understand that as well. So prediabetes is an elevated A1C. So that's typically how it is determined, by hopefully you connecting with a healthcare provider and getting a screening. In that A1C, there's a range. And so a pre-diabetes range is a range that, again, is elevated. Your A1C is above the normal range, but it is not in the range that is considered type 2 diabetes. So it's right before, or right there on that cusp before your elevated blood sugar levels reach that of the definition of type 2. And that's where we want to try and catch people. And ideally catch them before even a diagnosis of prediabetes. But definitely it's in this window that if we can modify these behaviors in terms of what we eat, how we eat, and being able to get active, that we know that we can actually work to prevent type 2 diabetes, to include about 58% of those who participate have a chance of completely reducing their chances of getting type 2 diabetes. And that actually goes up to about 71% in individuals who are 60 and older. So if we think about, we're all living, longer. Some races more than others, but at the end of the day, life expectancy is getting, greater. And so the longer that we live, if we think about what we can do now so that we can have a better quality of life, SDFI is about creating those programs, creating these, centers within our congregations to be able to support the community as well as the participants, both during the program, but even after they've successfully completed the program, so that they can learn these, again, kind of lifestyle change habits and messages and way of life that'll serve them well beyond the program. And so the goals that we've set specifically for our Southeast Diabetes Faith Initiative is one that we definitely are delivering, the CDC recognized lifestyle change program. It's also known as the Prevent T2. But we are doing it again with a culturally tailored approach, and we are primarily focused on underserved communities. So people are like, oh, it's in the Southeast. And so, yes, because if any of us who have ever looked at maps of obesity, maps of diabetes, maps of high blood pressure, maps of any pretty much chronic condition known to man, the South is lit up bright red or whatever color it is to indicate a high prevalence. So that's one, but then also when you drill down within some of these states, a lot of our rural communities are also hardest hit and impacted by it. And they also lack a lot of the other opportunities and access to larger health system or access to more just preventive opportunities. And so those are the areas and communities in which SDFI is focused on. That again is not to say, because I think there's been a few comments in the chat, that is not to say again that we aren't looking to expand. Again, Mississippi is the 6th state that we expanded into. And we definitely continue to work to leverage our community and partner organizations that support our participants and our affiliate sites. And so we are always, open to finding ways to take and bring SDFI to communities, to include other states, to where we feel that it would be beneficial to do that. So again, if that's something that you're interested in, you're not in these states, that does not mean that SDFI is not here for you. Because of COVID-19, we all had to switch, like many people, to a distance learning format. We will continue to provide SDFI via this format as well. And so that does give us an opportunity to kind of spread our wings a little bit geographically. So I want to thank you guys for those comments that we're seeing. Another goal is that we do want to look at promoting diabetes prevention and wellness education, again, centered and focused on what are the needs of our minority populations. And then, as I mentioned, we want to continue to work with community and partner organizations that provide support to the participants, as well as our faith-based sites. And then the last two, which are really, really important, and we're actually going to be having a follow-up a meeting or webinar for these two particular populations, and that is our healthcare, our providers, our health systems, our clinicians, allied health professionals, as well as our employers and insurers, because we need to increase the screening, the testing, and then actually referring individuals who are found to have prediabetes or at risk for type 2 into programs like SDFI. As I mentioned, when 9 out of 10 people don't know that they have something, one way to do that is to increase where and how screening and testing is happening. And then also to make sure that we eliminate a barrier to people being able to participate in these programs by offering, especially employed, working individuals, increasing that opportunity for these programs to become covered benefits, so that your employer is contributing towards you doing something to help get you healthier. And so we'll again look forward to having that conversation. I believe it's going to be in April. If you want to learn more about either upcoming events, if you want to learn more about where our affiliate sites are, how to connect with them, again, in the chat, you can find a contact form to reach out and connect with us. And then you also can just visit us at www.balmingilead.org/SDFI. And it has some really great, amazing information, again, centered around what we're doing, focused on these goals for SDFI. And then what are some of the keys? So again, we are using the same curriculum of the CDC's National Diabetes Prevention Program, their Prevent T2. But what kind of sets SDFI apart is that we are utilizing a phased or community-based cadre of trained lifestyle coaches. So our coaches are individuals who actually come from, they're familiar with both these churches who are hosting our sites, as well as the surrounding communities that they're serving. And that is very, very important. Message and messenger matter. Especially when we are talking about something that requires a true shift in how we see food, what we think about food, again, culturally, food takes on many, many, many different meanings within Black and Brown communities. And so it's important that our coaches not only have the training that they've been given and provided to by CDC and their training centers, but they also, again, have an understanding that's based and rooted in them being able to connect with the individuals who will subsequently be in their programs. And then that also lends us to our state managers and our other leadership with our program coordinators to, these are vetted, community-minded individuals who have been in the health and public health space. But more importantly than that, they again are truly connected from a grassroots up in these states to be able to support this infrastructure, if you will, that we've created with SDFI. And then definitely leveraging the influence and the power of our faith leaders, having their input, having them secure their buy-in, having them support both in enrollment and engagement and recruitment. And even prior to COVID, just opening up their doors to allow us to be able to host these programs is no small feat. And is definitely different in terms of perhaps some other ways in which the NDPP has been done. And then we also realize that the way in which we've gone about structuring SDFI, that it really does get to some of the trust and engagement between our community-based partners, between health providers, between participants, because we do need to make sure that we have that trust, that level of engagement that is about relationship building. And that's what SDFI is about. And then we incorporate also what we call ancillary sessions that are really culturally tailored. So the curriculum has its set of sessions and modules and topics, but we wanted to make sure, one, to keep people engaged throughout the course of the program. We also wanted to think about, well, what are some other things that are also equally important, whether that's the relationship between heart health and diabetes, addressing some of the challenges and barriers to physical activity. And so these ancillary sessions are really key to how and again, what SDFI is doing to prevent type 2 diabetes. And then we created this entire infrastructure. Again, we created and implemented based on the Balm In Gilead's faith-based mobilization model. So that allows us to incorporate things such as advocacy. Obviously, there's a huge amount of evaluation that goes into a program of this size as well. But the actual, again, mobilization of these communities, of these congregations and churches to really help and do the heavy lifting for what is now a program, or excuse me, an initiative that's in its fourth year. And we're really looking forward to what's to come, and growing and again and expanding this model to serve more people. So what's next? So now that we've kind of, given you again a sense of kind of what SDFI is, how we were structured, slightly different perhaps from other DPPs that you may be familiar with, what our goals are, why this work is so important to us, and kind of why we've taken this approach that we have. So kind of what's next? And so the beauty of one of the things that we are moving or transitioning SDFI into is to really look at how we educate, how we are going to transform, and then how we live. And so in order to do that, I am so excited and happy to have with me some amazing ladies who are going to join me in a discussion about just those two things in terms of transform and live. And so I'm happy to bring with me or bring on Ms. Kimberly Lovelady with the Black Women's Health Imperative, who BWHI is a major partner to the Balm In Gilead. And then also, again, our sister that we are happy who is able to join us, and that is Miss Nikki Gilbert Daniels, who, as I mentioned, she is a strong women's health and equity advocate, to join me as we talk to have a conversation about what's next. Hello and good afternoon.
Hello.
How are you?
I'm well. How are you?
I'm doing pretty good. How are you, Kimberly?
I am doing
excellent.
excellent.
And I'm great. And I enjoyed the beginning of the presentation. I'm like, yes, I'm in the right spot.
Perfect. As I mentioned, I wanted to have that just to kind of lay the groundwork, but I think here's where the kind of nitty, as my grandma would say, the nitty gritty, comes in. So as I said, we want to think about educating, which that first part was maybe more of the educating of, why this is so important. We've got millions and millions and millions of people impacted by this pre-diabetes. But now as we think about, well, what is it going to take to get us to transform? And so first, I want to give both of you an opportunity to just share with everyone, one, definitely, a little bit about your, background, why this is something that is of important to you, but then also what you as an individual, as through the organizations that you work with and represent, and what you all have done in this space of diabetes and trying to get people, especially Black people, Black and brown and minority people who, again, we say underserved, but they're really under-resourced. And so, give you guys a moment to talk about and share kind of what you've done a little bit in this space. So I'll start with you first, Nikki, and then I'll come to you, Kimberly.
Well, first of all, thank you, Pam. Our introduction was speaking on one of the BOM's panels about diabetes. And I just lost my mother. And I just remember each day a nurse coming in, pricking her finger. And I was just like, oh my God, what is going on? And I just have several friends who have been impacted by it. Luckily, I have some who were pre-diabetic and, changed their diets and everything changed. I have a few. I was just talking to one of my best friends in the world a couple of days ago, and she's just like, oh, my sugar's going up. And it's just really shocking how many people are impacted by it, how many of us don't know we have it, how preventable it is just by changing diet. So me personally, being someone who has struggled with my weight throughout my career, it's been a thing, and just making sure that I'm eating the right things, and not just eating the right things, getting my blood flowing and exercising. You mentioned earlier mind, body, and spirit health and how important that is, and it all goes and works in tandem. So it's just a real passion for me because there are so many people that I love in my personal life and in our community, people I've never met. And I feel like something as preventable, as this disease should be something that we should advocate for every opportunity we have. So anytime you ask me to step up and speak on behalf of the Balm In Gilead or just women's health, our health overall, I'm here 100%.
Thank you so much for that. And you, Ms. Kimberly?
My road is a little different. I actually, in my many moons ago, my first child, I was personally diagnosed as prediabetes. I had a prediabetes diagnosis. I did not have prediabetes. I'm really clear on how I say that, what we own, right? And I realized that diabetes was not my destiny. And my doctor, I had a really great holistic doctor. And so she worked with me on changing my lifestyle and stuff like that. And it's interesting because my sister and I were both at the same spot. We think about genetics, and we'll talk about that, the risk test later.
Right.
And I was like, okay, I need to make some changes. And my doctor was really on me to make changes. And then my sister was too, but she struggled a little bit. And as we went through, I went to normal blood glucose range, and my sister actually progressed to gestational diabetes. So just even within my family to see how it helps, and we all have our own journey. And so we work together. So, and that really spurred the work for me around diabetes, prediabetes, because I noticed personally how the changes can really affect our lives. And then from there, beginning to do the work with Black Women's Health Imperative, which is the only national nonprofit organization dedicated to advancing the health and equity and social justice for Black women and girls. So it all fell into place. And as BWHI began to do the work, we started noticing exercise, getting active and eating healthier was great, with no shame on our cultural foods, because we can have it. We just need to learn how to do it. So that was really key in our messages. And so when you talked about the messaging and how to change it, we said, how do we embrace what we have, and how to make, being a Black woman is an asset, and let's look at it as an asset and not a deterrent. And so now, what does that look like as we gain ownership of our health, and we take and with the advocacy and things of that nature, and we just begin to evolve the National Diabetes Prevention Program in such a way where we have our distance learning app now that is specifically, our first iteration was purely for Black women unapologetically. We wanted to make sure that we had something that we can look and like, I see her, I know her, that looks like mama, that looks like we can identify with, and the coaches was there, and we were intentional with it. And so that was how we're starting to shift the conversation, move the needle, and take ownership of our health. Yeah.
Wow. So much of that. And again, this is why I love having these conversations. And to Kimberly's point, I am always happy to be unapologetically Black. That's what, I think owning that's okay. Because I think, to Kimberly's point, sometimes we may shy away from creating things that are solely focused on us, at the fear that we're going to alienate other people. So I really love that. And then Nikki, I know for you that you do a lot of work, and something that is very, very, very important to you, especially I think as we have a conversation about what's required for this transformation to take place, right? Ownership. So Kimberly Minute, whether that's, ownership of ourselves, I think ownership of how we are going to have our journey. But then also ownership, as you guys mentioned, whether it's an app, whether it's technology, and ownership of our stories. And I know that's so important to a lot of work and a lot of efforts that you put in, Nikki. So I'd love to get kind of your perspective, especially when it comes to some of the narratives, some of these myths about Black people and eating, or especially like Black women and eating, Black women and getting active. Love to hear some of your thoughts on like your experience in that space, but then also things and ways that you can share for folks to shift that.
Absolutely. The biggest thing, again, going back to that mind, body, spirit space, I think it's super important for us to identify the stressors in our lives every day, because I'm a person who wouldn't eat sweets all the time, but baby, if I have a bad day, or if I see something that nighttime moment goes into the wee hours of the morning. So I think that our eating habits and our just overall fitness habits are connected to what's going on in our minds. And I think what is going on in our minds is impacted and affected by the things that we see every day. All the narratives that are not so special. And I think it impacts us in ways that manifest in our not taking care of our health the way that we should. I think it's super important on a global level. I'm such a huge advocate of owning our narratives, owning our stories, owning the things that impact us every single day, the things that impact us and then in turn impact our children, impact our future generations. It is all connected.
Yeah.
Is just that the healthier our minds and our spirits are, I truly believe the healthier our bodies will be, because we see ourselves for who we are. And it's like you wake up and you're like, oh, I have diabetes, or I have heart disease, or I gained all this weight. Where did it come? Nobody's that in love with food. Nobody's our situation lead to us not taking as good care of ourselves as we should. And I'm working diligently on helping to change some of those narratives and some of those situations that drive us to lean on habits that we shouldn't. I think it's all so connected. So with our Work TV initiative and From the Bottom Up Foundation, owning who we are, owning the responsibility that we have to ourselves. Pam, you and I have spoken about self-care and the importance of taking care of self right? And not being ashamed of that or feeling like you can't afford to do that. To your point, you can run a bath water, close the door, go missing in action for a couple hours in the house. But getting your mind and your spirit right, I think is super important to being a healthy individual. And that is just as much prevention, in my opinion, as eating right and working out, mind and spirit connected.
Absolutely. And yeah, I couldn't agree more. And I think sometimes we don't have that disconnect. Like when we talk about physical activity, or if we talk about eating, we're thinking about, again, maybe the actions of it, as opposed to, okay, well, what's mentally driving those things? So I think that's super important for us to consider. And then Kimberly, I also wanted to touch, you mentioned that like in your own personal experience, you had an amazing holistic provider. And so I think at the same time that we know that there's some transformation that we have to do as individuals, as communities. I think it's also equally important to say, okay, well, how does healthcare, how do providers also then shift or need to shift to be able to kind of not just meet us where we are along these journeys, but how can they, again, do better? I think especially about addressing the fact that so many of us don't even know that we have prediabetes. So can you share, because I know BWHI, you guys do a lot of great work with kind of healthcare providers and kind of in this space. Would love to have you share a little bit about that work and what are some of the ways in which you're trying to, bridge that gap between healthcare and the community.
So with the healthcare and in the community, it's a twofold. One is from the individual and being our own advocates and really starting to learn and know our bodies so that we can speak about it when we are in contact with the healthcare provider. That's number one. And so we do a lot on self-advocacy, but also we're doing a lot of work within hospital systems and with physicians, and some of our master trainers are physicians. So we're kind of crossing that gap to make sure that not only we're coming from a medical perspective, but as well as from a healthy lifestyle perspective and branch it into, because most of the time we assume that the healthcare providers have had that training, and a lot of them don't. A lot of prevention training, it's just like oh, do you want to take that extra class? And so it's been a big shift, and we're doing it with a lot of healthcare. We work on a project with American College of Preventive Medicine and with different hospital systems to make sure that the physicians, the hospital system is in a place to not only do the diabetes prevention program, to refer to know that it's important, to refer the patients and to have a real conversation and understanding. Because what we're finding in some of the research is also shown is that providers want to have the conversations, but they don't know how, and they've never been trained. So some of the work we're looking at now is like, oh, we have to really do some work with training the providers to have that conversation. And most of the time, I'm looking in the rural areas too. Typically, you have most of the time you'll have your physician champion. Yeah. And that person is the one that's going to help push the organization and push the conversation and make sure that it stays front, even in the midst of pandemics that just so happen to pop up and everything. It's like, it's still important work. And the biggest thing is training the healthcare providers to be able to have that conversation, because I've noticed with some patients, especially around social determinants of health, which is the other items and different things that contribute to health outcomes. It may be education, it may be work, it may be your social support. And right now, a lot of our seniors are not connected. They feel so disconnected and lonely. So that can have a major impact on how your health outcomes are. So just having that conversation around those other things. And sometimes we have a list, right? Most providers have a list. We've all had the valid scale where you check off, ask this question, ask that question, ask that question. But if you don't have the empathy, sympathy, and the know-how and the compassion, and when you're asking that question, it could come off as offensive. Or just a lot of Black women are saying right now, I feel like my healthcare provider doesn't hear me. Right. They don't hear what I'm asking, especially around, I know we're in diabetes, but it's really loud in the maternal health arena. And so we want to make sure that not only are the women, and we're beginning to take ownership of our bodies and knowing it, and be able to communicate it to the healthcare providers and the facilities, but we're also working to help the facilities. Are you not just culturally competent, but I'm saying culturally proficient? Are you relevant? Do you really get what's going on in the communities that you're serving? Not just the one class you have, but really get it with all of the different pieces and the intersectionality of what your community going through, because all that plays a huge role in the impact of the health outcomes.
Absolutely. And it's interesting to hear you say that, because I think that's always something that comes up in the conversation. The difference between, as you pointed out, being culturally competent and culturally proficient, and what those means. I think even our training, as you mentioned it, some of the reasons why it lacks is because cultural competency, even from nationally, federally, what gets produced and provided to providers, really just across industries, when we have this conversation around cultural competency, so much of that lens is focused on language barriers, or it's focused on, well, did you produce a material that was at a health literacy level that everyone, at a third grade level more could read it. But to your point, that doesn't get us to where we can actually have providers and healthcare systems that are proficient to really understand, to sympathize with these communities that they're serving, so that you can get at things such as implicit bias, so that you can actually get at some of the, maybe, again, that disconnect between, as you put it, someone saying, hey, look, I just don't feel that my provider is hearing me. There was a story, again, about just women and their kind of experience, and especially around this conversation about obesity. Obesity and diabetes are huge, because obesity is just one of those risk factors that increases your risk for developing type 2. But it is also something that has a lot of nuances, both from a social determinants of health standpoint, but then also culturally and societally. And as you said, I don't think right now we have enough folks doing the work that BWHI is trying to do, of being able to bring that level of education and awareness to our clinicians, so that they feel okay and they know how to have these conversations, and you don't unintentionally shame someone for being overweight simply because you don't know how maybe to have that type of conversation. So I want to thank you both for that. I want to shift now to, as we think about, okay, live. Because that's what ultimately our goal, as long as we're here. So hopefully, yes, just, keep living, hope, to be able to continue to live at a high functioning, high, quality of life, and whatever that means and form that takes for us as individuals. So I want to kind of shift to thinking about that space of living and actionable things that we can take. So like, I know, Nikki, you mentioned, and I, when we had our conversations about self-care, and that being huge. But what are some other ways in which women, especially minority women, we can do to really live this authentic life, but being able to do it in a way, like you said, that's more healthy for us long term?
Oh, wow. I think discovering your passion, which is super duper important. I think we go along to get along so much. In addition to self-care, which of course is, as we mentioned, any opportunity that you have to take a long hot bath or take a long walk or go and getting your hair and nails done sometimes is simple self-care. But I think discovering your passion and feeling really good about what you're contributing to the world. There's this thing called ikigai, which is a Japanese saying, am I doing something that adds value to the community? Am I doing something that makes me happy? Am I doing something that generates revenue? So it's just finding this space of, what is it that makes me feel like I am alive? What is it that makes me feel like I'm contributing something amazing to the community and to the world? And it doesn't have to be like this really huge, we look at celebrities and we look at, wealth, and we look at like houses and cars and like all of this material stuff. But if we all broke it down to the very basic things, what makes us most happy is like a yummy dinner with friends, you know what I'm saying? Or like watching a great movie with our spouse or our significant other. It's the simplest things. And I think finding joy in those simple moments is super duper important to having a better quality of life. And I think just really working to discover, what is it that makes me feel like I am operating in my purpose? What is it that I feel is bigger than myself? If that means you're coaching a little league team, or you're teaching young girls how to knit, sew, or, braiding hair, whatever it is, it makes you feel like I love doing this and this makes me feel alive. I think you start doing that and then eventually it will come to you in terms of it being a way to sustain, your lifestyle and not being afraid to just step out and pursue passion and pursue purpose and not be so concerned about the status quo, because that comes and goes. And I think that over our heads and that demanding sort of, I need to look this way, I need to sound this way, you know what I mean? I need to change myself physically, that internal change, that thing that happens on the inside that you see first, and then other people start to recognize in you is living for me, and leaving some legacy behind as a person who went for it and wanted to help people. And like the Purpose-Driven Life, the first few words in that book, it is not about you, and that's kind of like how I attempt, at least, to go about it. And intention is living. Positive intention to not harm another person, but to add value to their lives. It's just as simple as that for me.
Wow. So all of that. And again, it sounds simple, but I think, because of, external noises, again, just really having a society that really wants to, push back on everything that you just said. But I do, like, those things are so important. Earlier I mentioned about our coaches, why we select the coaches that we have. And even Kimberly, you mentioned how, you go about selecting and having your master trainers and these champions in these communities. Because I think that is so important, because they live there, as we're talking about living and being intentional and wanting to have people who understand that this program is so much bigger than themselves. And whether it's 5 people in your cohort or you got a cohort of 25, those are still individuals who you are being able to impact in a really significant way, for not just their future, but their children, their loved ones, who can see them kind of embark on this journey to better self, this journey to whether it's a sexier you, whether it's just a fitter you, again, whatever that you is, everybody now is looking for their summer bodies and trying to work on their summer bodies. Would be nice if we just kept, we just kept a little bit of that summer body year round, as if we were, lived in Hawaii or something. But I think, again, those things are really important. And so, Kimberly, again, for you, as you think about what are the, kind of some call to action, some actionable things that we can encourage, women, their families, again, minority communities and our healthcare and providers as well, to say, hey, look, these are some things we can do to live better, or, help those around us to be able to live better.
I'm in agreement with Nikki when she said, find your purpose and your passion. And as you do that, my biggest thing is about de-stressing, and really, because there's so much going on, some things you can control, some things you can't. You can't control what happens, but you can control how you react to it. And one of the biggest things is that, especially as women of color, when we think about the diabetes prevention and diabetes and our weight, we like to gain weight where I call in the sexy spots, between the belly button and the top of the knee. And that's where the cortisol likes to sit. And some of us, we're living in a state of chronic stress.
Yeah.
And it's just, it's so innate that you say, that stress. You're like, no, that's just what it is. It is what it is. No, it is not what it is. Like, let's change that conversation.
Yeah.
And see, how can I work with how I respond to it and then how it responds to my body. So I'm really big on distressing. And we've even incorporated extra modules in our Change Your Lifestyle, Change Your Life curriculum with the one that I said we did for Black women, to deal with chronic stress.
Yeah.
Intersectionality of what we have. And also sleep, because if we can eat well and we can move, but if we're in a heightened sense of stress, that weight is going to hang on. The tension is there. The blur get out of the face, the hair. I have a nice little patch back here that likes to fall out when I'm extra stressed. That's how I learned. So my biggest thing is learning how to control that cortisol, how to help you control it. And one of the things, instead of saying it is what it is, I really challenge everyone to have more of an oh well statement, not a oh well I give up, but a oh well, this has happened. I'm not going to avoid it. It's happened. It's not the end of the world. I get it. Like, that's one of the questions, as well as instead of all this multitasking that we do, single task, stay focused, get narrow, focus in on that one thing, as well as just be mindful, because a lot of us, like 40, we spend most of the time in the past or in the future.
Right.
How about let we stay right here, because that can help decrease some of those stress levels. And we really have to learn. Those little things are some of the things that I would take with us, is really that stress, and learning how to manage it, and learning how to reduce those levels can help you do better without the fight or flight response that we're having, as well as to help get us towards our healthier weight and reduce our risk for diabetes. Absolutely.
Absolutely. And again, I think both of you just touched on really great points. And I know, again, just through the partnerships that the Balm In Gilead and our SDFI program has with BWHI, being, again, kind of co-grantees on a project where we are, again, we're trying to create create more spaces, if you will, for these types of lifestyle change programs to exist. And to your point, and can we wrap those in some culturally tailored types of resources that can help people be successful, both in the programs, but then even being successful beyond those programs, whether that's helping providers with doing more screening, more testing and referrals, as you mentioned with your work with ACPM, but then also, our work with different MOUs and providers in the states that we are currently providing programs in, to where we can have our state managers reach out to local health providers and to, like you said, and to say, hey, let us tell you about this program. Let us share with you some of this kind of real life, real lived experience for your patients. And then again, having and creating that partnership that allows the clinician to also be a part of this conversation. So once a person is enrolled and they're participating in the program, sharing back with that provider, hey, this is how it's going, or this is something that continues to also be a challenge. And then what are some of the things that we can wrap around to address some of those kind of social needs? So I know, Kimberly, you mentioned that you guys created an app, which I think that's really, an interesting thing to have an app, knowing where we are in this kind of mobile technology space. And so I would love if you, before we open it up to questions, just to share a little bit again of kind of about how your relationship with ACPM and the work there, and how, whether it's through apps, through its screening, through your champion work, how especially some of those social needs for the participants has been helpful for you guys.
And well, the app and the social determinants of health, where the social needs are they're in together. In the app, some social needs are factored into the app, is how we did it. And so as we're looking into the programming, as the participants go further into the programming, some of the things are addressed and the questions are asked, because and even with our work with ACPM and American Medical Association, what we're doing is making sure that the hospital systems that we're working with that are doing the DPP program, that they ask the questions, where's the best time to ask your patients and participants their needs? What's the best way in which to ask them what they need? And then how do we address it? And knowing that the hospital system, we may not have all the answers, but how can we partner within the community? How can we partner with the experts in those areas to make sure that the needs are being met? And I think that's some of the work that we're really finding out. A lot of orgs think that they have to be the end all solution, and you don't. The biggest thing is that we all have been blessed with different gifts and we have different passions. And so if you link to the organizations that's where they shine and that's where they excel, everyone wins and the patient wins. So it's creating a win-win environment all the way around. And so when you get the different partners in, the partners can refer to the program. They can also tell the people about, make sure that, everyone, they can have the risk assessment. Ours is at bwhi.org/CYL2. And I know you all have where they can also do the risk assessment. So all the orgs have it. So we're pushing people, let's find out where you stand. And then from there, how can we as a collaborative, as hospital systems, as nonprofits, as participants, as everyone, how can we all come together to move the needle and redefine what it means to be a healthy Black woman in America?
Wow. and I think again, you mentioned it, that's the key. It's the partnership, it's the connecting, it's finding out what that need is and where people stand. So again, I know that throughout the chat, I think I saw the link to our online assessment is available on our website at www.balmandgilead.org/SDFI. But then there's also just a PDF, because again, everybody is not averse and wants to do something digitally online. So that PDF is also available for folks as well. Before we end and wrap up, I think we got a few more minutes. I don't think Deja will cut us off, but to be mindful of everyone's scheduled times also. I want to give both Nikki and Kimberly an opportunity to just share your closing thoughts as we've had this conversation around preventing diabetes. But I think as we've seen, as you guys have talked, there's so much overlap in our lives. So we may be focused on a very specific disease and preventing it, but so much of what we do for one disease is something that if we can do it here, maybe for this purpose, it actually spills out into so many other areas of our lives, and the benefit goes well beyond you preventing, this, pretty consequential and sometimes, life-threatening disease such as diabetes. So I want to start with you, Nikki, and first just thank you again for joining and being a part of the discussion today, but would love to just let you have your kind of final thoughts.
Absolutely. First of all, thank you, Balm In Gilead. It is an honor to be on your panel. BWHI, huge fan, have done your game show as well, and definitely received my care package. Anybody who has any questions about women's health, please make sure you are following and supporting both of those organizations, because they are amazing and I learn something every time. When you said not living in the past or in the future, but staying present, oh, child, that's just something through my spine. It was so important. And I think I would just reiterate that sentiment. Just discover your purpose and your passion and what makes you feel really excited about waking up each day and contributing something. And I know it sounds crazy and difficult, and you're like, child, listen, I got kids and I got a real job and whatever, but I think that there's a way for us to discover what makes us feel good, and also provides some sort of, sustainable way of living for us. I think that's super important. So discovering your passion and just that quiet time and being present. That's what I took from this. Just being present in the moment and not being so concerned about what happened back there or what's happening up there, but what is happening right in front of you, because it can truly impact your perspective on what happened in the past and your opportunities in the future. So I'm gonna borrow that one, even though it did not, it did not come from me, but it impacted my life on this day. So I'm very grateful for that. And please support From the Bottom Up Foundation. We are working really hard to help change the narrative overall of women and girls of color. To Pam, your point earlier, we are unapologetic about the fact that we are specifically working to help improve the narratives and the stories and the equity and the equality of women of color. It is so, so important. It is what gives me passion. It is what drives and motivates me every single day. The singing thing is a gift from God, and we're doing more brownstone stuff. But my passion is From the Bottom Up Foundation, and just really trying to, change the narrative and diminish the stereotypes, because I think mind, body, and spirit health go together. And that's a big part of our mental and spiritual health.
Absolutely. So yes, and again, I encourage you guys, like I said, this is something both, as obvious as you can see, both Nikki and Kimberly, these are things that they're passionate about. And I think, yes, we can wear many hats in these roles. SDFI obviously is a program of the organization that I work for, that I'm the deputy director of, but I've been impacted personally, like many of those of us who are on today's session, those of us that we work and we come in contact with, whether it's ourselves, it's a loved one, a mom, a dad, an uncle, a grandmother, a grandfather. And so it's so important, I think, for us to be able to, see ourselves within the work that we do. But then the Southeast Diabetes Faith Initiative, again, for us, it is meant to embody that. And it is meant to, to your point, Kimberly, of seeing where some of these gaps exist and what can we do to meet these needs? What can we do to make sure, that these individuals aren't just, we're not just running through a curriculum, this evidence-based curriculum, but we're really, like you said, we're thinking, okay, how is stress coming to this community? How is stress impacting those who are in these programs, and what that looks like? And so that is so important. I know as we move SDFI forward, and definitely continuing our relationship with the Black Women's Health Imperative. Kimberly, I'd love to again kind of get your takeaways or your just kind of final thoughts on today's discussion before we wrap things up.
Well, Pam, thank you so much and you and the Balm in Gilead for inviting me on. And Nikki, you're awesome as well. My biggest takeaway from everything is just for us to remember that chronic illness, whether it's diabetes or anything else, it is not our destiny. That it does not have, because it does not have to be your destiny. We can make some decisions and how we want to choose to live our lives. And I'm saying choice because it's a choice, because sometimes we may choose that I don't want to do nothing about it. And I'm okay with that as long as it's a conscious choice that you've made. And that's the biggest thing, is like, believe that we always have choices.
Yeah.
And then we get to determine what our destiny looks like. That's my biggest.
Wow. Both, I think, again, what both you and Nikki said are very powerful, I think, takeaways. And, one thing, like we've talked about, where we stand, being forward thinking as opposed to, backwards thinking, and all those. And I think, yes, whether it's taking the risk test and finding out, are you truly at risk? Because I think you don't have to wait for that blood test to happen. Those risk tests are proven, they work. And again, they're available now in a lot of different spaces and places for people, but knowing at least that, and to your point, Kimberly, that way now you can make a conscious, informed decision of whether or not you choose to do something about it. If you choose to do something about it because that risk test says, hey, look, this doesn't look too good, and you really are at risk for developing type 2 diabetes. If you want to do something about it, again, we strongly encourage you to connect to any of our state managers who are available to you by email. They can set up conference calls with you. If you're an individual, if you are an organization who says, hey, look, I just want to learn more because maybe I have access to people who would benefit from some of the programs that you all have shared and talked about today, then please make sure, again, that you connect with us. BWHI, like I said, they are, even before our work in diabetes, BWHI had worked with Dr. Seal on some other projects. And again, to be the only, which is a good thing. And then at the same time, it's kind of, you want to say, well, why the only? But the only organization, again, to have this focus, this I'm going to say a hyper focus, which I love, on women and health equity. And so again, with all the information that has been shared via the chat, going to our websites, connecting with our state managers, and just learning more, it's our hope that, yes, now you feel more informed. Now you feel, again, educated. You've got a little bit of information and some little kind of how-tos of beginning this transformation process to get to a healthier you, and knowing that that's your destination, that's your journey. And then how we want to move forward in a life that, again, it's full, that it's connected in both mind, in both body, and is also in spirit. And so, again, we really, I think I'll wait for Deja to let me know. I think we got to most of the questions that had come through the Q&A, and most that had come up through the chat. Today's session was recorded, so we will make sure that all of those who actually attended, and then we'll also make sure that those who maybe could not or had to hop off, the links will be made available, and you can follow the Balm In Gilead on its social media channels to know when the recording would be available and how you can access it. It'll also live, obviously, on Facebook, where we've been broadcasting live today. So again, if you had a chance to miss it, or if you know someone who you feel like, hey, sis, you should have been on this call today, you should have been a part of this webinar. Like I said, maybe Kimberly or Nikki dropped some nuggets that could hit your spirit, or hit your spirit, and you want to make sure that you can pass that along to someone else. Please make sure that you do. Kimberly said it well. No one organization, no one person, no one community can be the end all be all to address a lot of the things that impact us to be able to prevent things such as diabetes. But together, collectively, I think as one on one accord, with the level of understanding and empathy towards one another, we can really, again, I think, begin to move these needles so that hopefully when the next pandemic hit, we won't have, catastrophic death of our loved ones simply because of something that we could have prevented. So again, I want to thank everyone for taking your time out today. I think Deja said we got to all the questions and the things that had come through the chat. Again, I want to thank Dr. Pranessa Seal, our CEO. I want to thank our amazing Marcom team, Ms. Maria Rojas and Deja Jackson. And then definitely want to thank and kudos to all of our SDFI team, Tanya and Travis and Miss Deborah, Miss Pat and Charmaine, like the whole squad. Y'all all know how I feel about you. I love you dearly and really value and appreciate the work that you do. And then lastly, to our amazing panelists who took the time to join us today, Miss Nikki Gilbert Daniels, who she knows I love her dearly, and to Miss Kimberly, beautiful. I've been staring at your mohawk all day. I love it. I really, I just love a whole nother conversation. But again, I love the work of BWHI. I love you for taking the time out of your day as well. And again, if everyone will, again, follow us on the website, follow us on social media, because we will be bringing more of these conversations, more of this education, more of this transformation, and more of this living to you, to a webinar or Zoom near you soon. So thank you, everyone. Enjoy the rest of your day and have a blessed rest of the week.
Thank you. Thanks for having us.
Bye, everyone.
Bye, Kimberly. Thank you.